Hi, this is Dr. Schmo from the Functional Neurology Center, and today I'm here with Dr. Sergio Azzolino as a part of our Technologies and TBI mini-series. And today we're going to be discussing the prevalence of Lyme disease in post-concussion patients. And Dr. Azzolino is going to talk about his research, and I'll ask some questions, and we'll get into it. So, yeah, I just wanted to start off with, why were you checking for Lyme disease in these patients with lingering post-concussion symptoms?
Sure. Well, thank you, first of all, Dr. Schmo.
Yeah.
Appreciate having me on here. It's a great honor and great service that you're doing for everybody. So, my experience in post-concussion and Lyme disease and whatnot dates back over 25 years ago, where we were fortunate to develop a very specialized practice, as you have and others, in being experts in functional neurology and rehabilitating people. And as you know, with the services that we all offer, we're able to see great success with the treatment of post-traumatic head injuries and see changes that few in the world are able to achieve. So in doing so, we saw a high number of people that achieved great success, others that were not achieving as great a success, or were coming into us after having seen 15, 20 people, and we could see that they would say they were feeling better, and then at times they felt they were 100% resolved, and then things would relapse, and this was a cycle that many of them were describing over and over. So that was on one hand. On the other hand, I had a specialty practice focusing just on neurologic rehabilitation, and was fortunate to have a lot of physicians that were treating with complicated Lyme and Neuroborreliosis and whatnot, and complications, patients that were suffering from those things. They were referring those patients in, and we were getting great success with rehabbing those. Well, after a short period of time of dealing with both of these two different, seemingly different problems, we were seeing that there was a lot of commonalities among many of them, and we started checking our own patients. We started checking many of our own patients that had this sort of relapsing and remitting, set of symptoms. And what we found were a high number of people did have Lyme disease. And we started investigating this further and found shortly thereafter that a high number of these people that we thought were just suffering from lingering effects of a post-traumatic head injury had Lyme disease, and with treating their Lyme, suddenly their concussive symptoms were starting to improve. And so this went on for years, and it didn't stem just around Lyme disease. We have an integrated practice. I've been running an integrated practice since 1999. I've been in practice since 95. So we look at a variety of different things, from Lyme disease to mold toxins, to different infections, different toxicants, from metals to a variety of different chemicals and whatnot. And in doing all of this, we're able to see that there's a lot of things that affect cellular health, as we all know. And so in the rehab of these people, we started taking a much deeper look at all of these different metabolic factors and infections and whatnot. And as I said, once we identified the Lyme as a big component, we felt compelled to a responsibility to publish this, because so many people were running down one path or another and not getting the answers that they needed.
Okay.
So going forward from there, we did a very simple study, a retrospective study, where we looked at a year's worth of post-concussive syndrome patients that were not healing well. We found a very high number of them were actually positive with Lyme disease. This is not to say that Lyme is the only thing that many of these patients had, but certainly an overwhelming number, 36 to 39% of people were positive with Lyme. And my hopes and my goal is quite simply to wake up the entire world when it comes to concussion, because I do believe that much of what's happening with post-concussive syndrome, much of what may be happening with chronic traumatic encephalopathy, is far beyond just the concussion itself. It may be that some of these people have a greater prevalence for these types of disorders because of their underlying genetic makeup, underlying microbiome, underlying toxins and infections that they have in their body.
Okay. Beautiful. So, you checked around, what was it, like 200 patient charts, and reviewed through those charts, and then you saw that it was close to, what would you say, 30% that had
36% on the males, 39 on the females, and quite simply, this was just a small cohort that we looked at. We've done this on thousands of patients. It just is not published.
Yeah.
And we just wanted to get a sampling of this to see and test it, and it certainly does appear to be very statistically significant. So we're proposing doing a much larger study at multiple different centers, with everybody blinded on this.
Beautiful. So, I mean, what types of treatments were you doing with those patients then, after you got this information? I'm like, what kind of, what type of other labs might you be running, and what types of things are you doing to actually, treat the underlying co-infections and this inflammatory response to help get people better?
Sure. So first of all, as you know, no matter what people present with in our offices, if we examine the brain, as you do, and as many of our other colleagues do, there's a world of difference that you could offer these people in just doing appropriate functional neurologic rehabilitation. So regardless of if it's an infection, if it's a head injury, if it's a toxin that triggered the person's ill effects, we do still need to treat the underlying condition, and that is their underlying deficits that we all do so well. On the same level, if they do have an infection, if they do have Lyme disease or other viral illnesses and whatnot, not only do those need to be uncovered, but they need to be treated. So we do a fairly broad spectrum check on various different infections, obviously not just across the board, but on people that were suspecting things. And when it comes to Lyme disease, I think the question that you may be asking is, what is important about Lyme disease testing? And certainly, we use LabCorp and Quest Diagnostics and other, BioReference, other labs for a variety of different infections, ranging from herpes family infections to strep to, cytomegalovirus to a variety of different infections, toxoplasmosis gondii, all a variety of different conditions that we see or infections that we see triggering pandas, triggering low-grade encephalitis, and a lot of the issues that you see with Lyme also. But specifically when it comes to Lyme disease, those labs are quite poor.
Okay.
They're excellent for a variety of other things, but when it comes to Lyme disease, their specificity and sensitivity is quite poor. Many may know about the Western blot that's used. They look at Western blot, but many of the labs are omitting band 31. Band 31, you could read about this with the CDC, was a band that many people were reactive to if they received the Lyme vaccination. In my almost 30 years of practice, I've seen one person that's received a Lyme vaccination. So they've admitted band 31 and they've never re-added it in, unfortunately. So there's several different labs out there. We don't have any allegiance to one lab. I don't have any ownership in any lab or any supplement company or anything of the sort. But this study was done with IGeneX. IGeneX is a very reputable lab that deals only with Lyme disease, except for nowadays we're dealing with some COVID. But their focus is primarily Lyme, and what they're able to do is test not only Borrelia burgdorferi, which is the #1 organism that causes Lyme, but they've also been the leaders in testing what's called tick-borne relapsing fever, or relapsing fever itself can come from body louse also in mice. They also test a variety of different co-infections, because there's really about 18 different organisms that can trigger these conditions, and unfortunately, far too many people are only looking at one. So there's Babesia, there's Bartonella, there's anaplasmosis, there's a variety of different infections that need to be looked at also.
Right. So, I mean, with a lot of these patients that were not getting better, they have lingering post-concussion symptoms. I mean, like, what were the main symptoms that you were seeing in these patients? Was it like dizziness or brain fog or psychological type symptoms? What would you say?
Certainly dizziness and brain fog are at the top of the list, and fatigue. And as you know, with your expertise, photophobia and hyperacusis, a lot of tactile activity happening. And, we all know that you get somebody in with a traumatic brain injury and they can't tolerate light, they can't tolerate sound, any little movement they make, they feel dizzy or wiped out. And we would see the exact same symptoms in somebody that had a traumatic brain injury and somebody that also had Lyme disease.
Yeah. Are there certain areas of the brain that you would say that Lyme disease, seems to like to target? I mean, a lot of people in our group will talk about, Purkinje cells in the cerebellum or different regions in the basal ganglia. Is there anything that you've seen clinically?
I have. There's not enough research right now to say specifically. Certainly, I've seen certain things on various testing from people being extremely sensitive to optokinetic stimulation, being extremely sensitive to VOR responses and whatnot. Yes, the Purkinje cells, I believe, are affected. I believe the technum is really ramped up because of this, a cascade of events with mast cells and, the ARDS that we see with COVID is certainly something that we see with Lyme disease and some of these infections where you just get this, unregulated inflammatory response that takes off in the body. So I don't believe it's selective, unfortunately, to one part of the brain. I think it's fairly global. And one thing that I think is extremely prevalent that I would encourage all the practitioners to keep an eye on and all the patients alike is dysautonomia. I've found a extremely high level of dysautonomia with people with Lyme disease, with mold toxins and whatnot. And, that's not to say it's only from one area of the brain, but symptomatically, they certainly lose regulation on the autonomic nervous system.
So overall, there's just neurological fatigue when performing rehabilitation exercises with these patients, and you try and push them, but they just tank. And then you try to add and you try to layer more sensory stimulation on with them, and they just can't tolerate it. And they go into more of a dysautonomic regulation, and they seem to just get worse and worse and worse. So that's kind of what we see. So then, a lot of times we have to just start with doing one therapy at a time, maybe start with, tilt table or low level laser, something very simple before we go in to do more complex visual vestibular stimulation. But it does seem like a lot of these patients do have a lot of issues with visual vertigo and slipping and visual overstimulation. So, definitely there's some upper brainstem stuff that's occurring. And from your experience and what you've seen clinically and with labs, correct, there's a lot of interleukin-6 receptors in that upper brainstem?
Sure, and it goes far beyond that. I mean, we're looking at histamine levels, we're looking at, the mast cell response, like I mentioned, and you're looking at a storm of interleukins. But the challenge lies with these conditions is it's oftentimes, it's a rarity that these people have one problem. Usually you get the perfect storm. Somebody may have been infected with Lyme years ago. They had an acute response, it got suppressed, and they had complete regulation over it for 20, 30 years. And I think this is an important point that I want to make sure we make. They may have been completely healthy from their perspective, and then they get a head injury.
Okay.
When they get this head injury, they get this unregulated storm of cytokines. And as they get this unregulated storm of cytokines, their blood-brain barrier is now open, and they start to develop this inflammatory response internally. And so oftentimes these people may have had Lyme or one of these co-infections for a long period of time that was encased in a biofilm. It's a sticky substance that protects these organisms. So they, oftentimes will feel like we're crazy when we suggest get tested for Lyme. And I could tell you that's, I'm used to dealing with that for the last 20 years. People saying, well, I had a head injury. I understand you had a head injury, but we treat you as a person, we don't treat head injuries. We treat people.
Yeah.
And so, as you know, as a functional neurologist, I believe we are best positioned and, right at the top of the heap for any specialty to deal with these things, because I was fortunate to have been trained with Dr. Carrick 30 years ago. And as you know, with your expertise, our level of expertise can be very exacting, that we can not only identify the areas of the brain that are not working, but we can also identify their fragility. And so we're all very good at tailoring that up or down, as you know. And the challenge lies with these disorders. When they have this, we could spot if it's just a fragility because these pathways are not firing, or if there's actually some unregulated inflammatory response. And so I think it would be very good for all the chiropractic neurologists to be aware of this here, so that they could evaluate their patients from that perspective. And it doesn't take away from what we do as a specialty to be able to rehab these, because regardless of what caused the issue, we need to fix the underlying problem. But on the same level, you don't want to be spinning your wheels.
Yeah. So, if you're a chiropractic neurologist and you're working with a patient that's seen 3 other chiropractic neurologists, and they've done rehab and they've done visual, vestibular, and balance work and cognitive training, and they still have, lingering dizziness and fatigue, and they just crash, we should probably test them for Lyme disease.
Yeah, well, I think the first step is not just testing every patient, it's really taking a history, taking a history from where they were born, how they were conceived, and the maternal health, and going all the way through, because you know, the nature of what we do is we treat people,
Yeah.
treat brains. And if we look at people, you know that their life story is oftentimes different than I was playing, you know, X, Y, or Z sports and hit my head and everything fell apart from there. If
Yeah.
you dig a little deeper, you're going to see these things, and it becomes very evident.
What other labs do you think that people should have run if they have lingering symptoms? I mean, you know, should they have their thyroid assessed? Should they have a stool analysis? Any other things that you think people should just, it's a must for them to have tested if they have lingering
Sure.
symptoms and they're not getting better?
You know, I like to say basics of 101 functional medicine is certainly looking at, you know, stool analysis of microbiome is extremely important. If you have a leaky gut, you probably have a leaky brain, and that's extremely important to all of us. Certainly a full metabolic panel and a full hormonal panel is always key. You have somebody with a head injury, you're going to have some, you know, dysregulation of their HPA axis.
Yeah.
And you're going to see some hormone dysregulation. And so those are all musts to look at. On the same level, I do believe if we do a comprehensive history, you will be able to spot, you know, mold toxicity is extremely prevalent.
Yeah.
And extremely important. And we commonly see mold and Lyme and these other infections together. As I mentioned, we do a fairly comprehensive array of different infections, and you know, toxic metals are some things that certain generations are more exposed to. My generation, being older than you, certainly had our fair share of lead and mercury and whatnot.
Yeah.
So I wish I could tell you there was one lab only. You know, I think people tend to like to put too much significance on an MTHFR polymorphism, for instance, or an apoprotein E, E4 variant. We know these things are important. We know that they will slow down people's healing. We know it will change their neurologic function. And I think you need to look at all of that, because one person may have a little genetic predisposition, and then they have a little toxicity or a little infection, and then they have an insult, and it just drives things from there.
All right. Well, yeah, I mean, that was great. Is there anything else that you'd like to add that you think patients or clinicians should just really know when it comes to this topic?
So I believe patients and clinicians should be curious. If you're not getting better, you're not getting better for a reason. And I hope that all clinicians can aspire to getting to an expert level. As you know, you didn't get to where you did without a lot of long hours and hard work. And kudos to you and your team and all the other chiropractic neurologists out there that we see. And I believe, you know, it's why I tell patients, you know, if you're really ill, stick with seeing the A-list players. And that's not to say there's not room for everybody becoming an A-list player, but you got to be careful with dealing with these things if you're just looking at basic functional medicine. If you're just looking at hormones, if you're just looking at thyroid, if you're just looking at food sensitivities. You know, I myself, I could tell you I've been gluten-free for 19 years, a lot longer than it's been a popular thing to look at. And I could tell you I do believe gluten sensitivity is not the cause of most things. It's probably a symptom of underlying infective things taking place where you get the, you know, the immune intolerance and whatnot. So be curious. Keep looking, keep searching for answers, and hopefully practitioners do, because it's if you're constantly learning, you're going to constantly see more things that you could do to help people.
All right.
I've been doing this over 25 years, and I could tell you I'm learning probably at a higher rate now than I did then, and there's still a lot more to learn.
That's awesome. Well, thank you so much for coming on here today. I mean, I love just talking with practitioners that have been doing it a lot longer than, you know, what I've been doing it. So it, you know, I always want to keep learning, and, you know, we just want to help people. And, you know, obviously a lot of patients that we see have these lingering symptoms. So it makes me want to dig more into trying to understand Lyme disease and co-infections and mold, especially living here in Minnesota. I mean, there's a lot of Lyme disease, there's a lot of mold, and a lot of the patients that we've seen that, you know, don't get better, it's because there is something else that's going on, and we just have to dig deeper and figure that out. So thank you again so much for coming on today.
Thank you. Thanks for having me.
All right, man, that was good.
Sorry, a little long-winded up first there.
No, that's perfect. I mean, that's it, 30 minutes or so. I mean, that's basically what people can tolerate. So no, that was good. And then I'll post your information. I'll post that paper up there, and then we'll get that out to people.
Yeah, I mean, I think I didn't want to get into too much of the treatment. I'm sorry, I could if you want.
Yeah.
But
I mean, obviously it's good, it's different for every individual. So
yes. And then, yeah, send me a link.
yeah, I'll send you a link for this video too, so you can share it if you want.
All right. I appreciate it.
All right.
All right, Jeremy. Good work, man.
Yep. Thanks, man.
Take care.
Have a good one.
Bye.